My fellow Americans, this will be the first in a two-part series, the first of its kind on this channel. During the first of parts of these mini-series, I will try to treat upon policy proposals, which I might practically affect within a single or two-term presidency. And during the second parts of these series, I will try to describe the long-term goals which I hope these short-term actions might work towards. I would hesitate to consider these to be effectively campaign promises, given the nature of the campaign that I'm running, and the nature of exactly how party politics have become entrenched in a system that had no rules in place for such a development. I seriously doubt the efficacy I'll have in politics as they exist. But without a doubt, there are policy steps which I believe can find substantial support in both camera of our Congress from both sides of the political aisle, and most importantly, among the people which those Congress critters have been elected to represent. The first future policy mini-series here will treat primarily on a long-term crisis which is facing this nation, that of the disparity between the supply and demand of healthcare. To establish several definitions and premises first, I will have no truck with the claim that healthcare is a human right. Within the system that we've built, there's no forbearance against someone seeking their own best outcomes, to be sure. And there's certainly a number of legal justifications for those human actions which try to improve someone's own circumstances. Trying to stretch this to a claim of a right on the work or products made by another's work, or having been rightly traded for to another, is legally unjustifiable. Just like all other rights, your right to health care ends just, at that same sharp line where they interfere with the rights and freedoms of people around you. The old adage of your right to wave your hands in the air exists to the exact limit that your hand might strike someone else in the face. This includes, of course, the rights of medical professionals and chemical engineers to provide or not provide their services in those fields at their discretion. That all being understood, there is certainly a difference between the supply of healthcare available in our society and the need therefor. And I can understand greatly why people view this need in particular as one that justifies all number of exigencies, one that stretches the limits of otherwise common and decent behavior to new, previously unacceptable terms. It's a deeply felt threat to life itself in some cases. And a number of candidates in the current presidential election have proposed a number of policy changes addressing this need and its felt nature. Most of these policy proposal changes are related to how we might, as members of a society that is experiencing this difference between supply and demand, pay for the health care that we're presently getting in different ways. I thought to make a few proposals on a slightly different tack. To wit, 68 whiskeys. No, that's not a prescription for intake, though I could certainly understand why that might look like a good idea after a long shift or when staring at your insurance or tax bills. Rather, it's a reference to the Combat Medic Specialist designation, which is afforded to qualified candidates in the U.S. Army. I believe it's similarly listed in other branches, but I'm not remembering that off the top of my head. These soldier medics face steep barriers to entry when they leave military occupation and try to join the civilian job force, especially if they're trying to keep working in the field which we as a society have already spent no small amount of money and time and effort to train them. Lowering barriers to entry for military specialists joining civilian job markets will affect a number of industries. But this is one where it can have an incredible impact on everybody's life. Having paramedics who've already gotten training be able to just jump right in and to that job force and supply some of the needs which we experience would be incredible for everyone. It would increase the amount of competition in this particular job field, so we're going to have to think of a way to employ more medics and paramedics, and I have a proposal there as well. There are a number of national chains like CVS pharmacies or Walgreens, Walmart, stores, Kmart, Target, places where pharmacies exist on a community level. And I could definitely see creating a licensure on a national level for interstate commerce, these interstate chains to have licenses for medical doctors to be employed, not just pharmacists, but medical doctors to be employed within these stores. The idea being that having more access to medical care on a direct community level, not having to go to a hospital or an urgent care facility, but on every corner there's someone who can at least triage a wound, who can do a lot of the sort of basic general practitioner stuff that would free up a lot of the specialist time in more designated healthcare facilities. I could see that having a lot of impact on our healthcare system as a whole. It would break off a lot of the lower level cases, the things that don't really need a specialist's attention, and having the access be on practically every street corner, that would be super important for speed of service, for addressing needs immediately. And I could see people in that particular sort of position being encouraged to work with more of a proactive, preventative care regimen, seeking to provide nutritional advice in addition to, dealing with cuts and scrapes, writing notes for people's employment, so that they stay home and with the flu or the common cold instead of bringing it into the office. Making these things available to people on a street corner to street corner level would be incredible for people. As more important cases come into such places, the triage of things is naturally going to come across cases that can't be solved with, a Band-Aid and 2 aspirin. Having paramedic certified drivers standing by to take a case and get it to the hospital right away would be super handy. So I could definitely see facilities for, having an ambulance parked in a Walgreens parking lot would not just let people who are triaged in the facility get shipped off to hospital right away. It would dramatically improve response times for medical emergencies within the communities that such a thing is. If there's Billy falls out of the tree that he's climbing, having that many more ambulances and paramedics available would definitely impact that. And the increased competition in the paramedic market would lower the costs of such a thing, because it would make it more feasible to do, because the supply would be greater. It would match the demand better. It would lower the curve and make it more doable on a price perspective. Next big thing that I'm hoping to propose is a change in the necessary grades of our medical care. I know a lot of hospitals are being built with incredibly strict regulation about um, single patient, no more than 2 patients to a room, single patient to a room in most cases, and the certain requirements for space around the bed that's free and clear of obstruction, so that emergency teams can get in there, and that's just in terms of physical material taking up a lot of things and rising the cost of building hospitals and building access to medical care in these specialized centers. I would be amenable to an idea. I haven't worked out specifics for this one yet, but I'm working on it. Coming up with an idea to increase the number of wards in a hospital rather than specifically single room care. Transmissible diseases, contagions, would definitely need more sequestration, but I could see, people with burns or cancer, things that aren't going to jump from person to person. Having the necessary clear space with around a bed overlap with the necessary clear space of the next bed. I mean, the space is still clear, it just works for both beds. And that way you can lower the number of resources in a room necessary to actually build a hospital, which would decrease the costs that way too. Next video, I'm going to work on sort of more long-term goals towards our healthcare as a country and as a society. And yeah, until then, keep on making the world a better place. I believe in you.